Good morning, everyone, and a very warm welcome yet again to our Health Insights live event, my favourite hour of the month. That either means this is really good or my life is really dull. Maybe we'll go for a bit of both. For those of you that are joining us for the first time, we've created this series to discuss healthcare topics and challenges that are facing businesses across the UK. This is all part of our commitment to keep you informed on the latest trends we're seeing within Bupa and across the wider healthcare market. As a result of the pandemic, the definition of well-being continues to shift. We're trying to do our bit by helping you and your clients adapt to the new reality, exploring the prevalent and also the hidden healthcare issues that impact the workforce of today and tomorrow. And so you're always up to date with the ever-changing situation. We use this platform to share regular updates on our services and any clinical developments in the light of COVID-19. So for today's main topic, we'll be revisiting the broad topic of mental health, focusing on one of the more hidden elements, specifically the rise in addiction as a result of the pandemic. Now, you may recall during our October event, we revealed the results of our mental health at work study, which highlighted a number of things. Firstly, that poor mental health continues to be on the increase, with work and COVID being major contributory factors. 41% of employees say they have experienced poor mental health where work was a contributory factor. 54% of employees have cited poor mental health due to causes outside of work, and a third of these have listed COVID-19 as a cause of their symptoms. So it's evident that stress, pressure, and anxiety are all on the rise. And as we live and work differently, our ability to manage this is absolutely being tested. Increasingly, many are turning to self-medication to cope with the mental health impact of the pandemic, rather than just seeking help. Bupa Global's recent research supported this. 6 in 10 business leaders with mental health symptoms have turned to potentially unhealthy coping mechanisms rather than seeking help. 2 in 5 business leaders in the UK have self-medicated to cope with their mental health issues with alcohol or drugs during the pandemic, while others have turned to gambling or excessive exercise. 42% fear that speaking out about their mental health would damage their reputation, demonstrating that stigmas still exist and are preventing people from seeking help. These statistics are really worrying because of both the short and the long-term health issues associated with these behaviours. It's now more important than ever that we understand the hidden mental health impacts of the pandemic and its bearing on our workforce's well-being and performance. The emerging crisis in mental health will be one of the defining stories of this generation. What's more, those businesses that encourage good mental health and well-being in their organisations could and should see a quicker, more sustainable recovery than those who don't. So today, we're going to be hosting a panel discussion to specifically explore the rise of addiction in more detail, asking what organisations can do to identify, adapt and support employees facing into this challenge. And who knows, we may all learn a bit more about the warning signs that we should all be alive to when we reach for the bottle of wine on a school night. So in terms of the agenda for today, we're going to use the first 10 minutes as ever to share a quick update on COVID-19. You'll hear from our residents, James Sherwood, Director of Healthcare Management, on the hospital capacity and Bupa services. Plus, Dr. Luke James, Medical Director for Bupa Global and UK, is here to share as ever the latest clinical developments on variants and vaccines. We'll then move on to our main session, where I'm delighted to be joined by our panel of experts today, including Caroline Harper. Caroline is a specialist mental health advisor at Bupa, bringing over 13 years of frontline experience working in acute psychiatric inpatient, substance misuse, community mental health, and occupational health areas. Dr. Caroline Wood, Head of Behavioural Insights and Research at Bupa Global and UK. Caroline is an expert in behavioural science and is involved in several studies assessing the impact of COVID on people's health and well-being. And also we're joined today by Dominic Denison-Tender, co-founder and director of Perspective Analytics. They work to improve access to addiction treatment in partnership with the Bonds Clinic, who are one of Bupa's providers. Dom was also successfully treated at the Bonds Clinic in 2014 following a sustained period of life-threatening physical trauma that led to a dangerous painkiller addiction, forcing him to leave his position as CEO and board member of a successful international consultancy group. And he's got real-world experience of living with addiction whilst holding down a senior position. So I'm really excited for the panel discussion, Before we get started on that, as promised, let's go over to James.
Thanks, Mark. Hi, everyone. Thanks for joining the session. I'm going to give a short update on the current COVID situation and outlook for private services. Well, since the last event, we've seen the social distancing measures have a big impact on the spread of the virus. The R rate is well below 1 in all regions of the country. The number of daily new COVID cases is at the lowest level since the end of September and now falling quickly. However, the NHS is still under pressure, with the number of COVID cases in hospital only recently just falling below the level we saw at the first peak in April. The number of new cases being admitted into hospital is falling steadily, but thankfully, as treatment is more effective, patients are staying in hospital for longer. This means it will be roughly another 3 weeks before hospital activity levels are at a comfortably manageable level, and maybe up to another 6 weeks till they're down to the levels we saw at the end of June last year. The vaccination programme is making startling progress, with 17.7 million people now having received their first dose and roughly 400,000 people receiving their first dose each day. And the government is now targeting every adult having received their first dose by the end of July. As a result, the government is actively planning the easing of social distancing measures. I'm sure we're all very excited about pubs opening outdoors on the 12th of April. Prospects for international travel are still uncertain, with the government expected to consider a position on this in mid-April. Over the last couple of weeks, we've seen a number of the private hospitals released from the surge status and return back to offering normal private services. This is really encouraging, and I anticipate seeing more hospitals return to normal over the next 3 weeks. So the position as at the 22nd of February is as follows. There are 51 independent hospitals that are currently working under surge notices, which give the NHS priority to use all capacity at those sites. Of those 51, 15 are only offering urgent surgical services for priority 1 and priority 2 cases. So those are patients that require treatment within a month of diagnosis. And 36 of those 51 are continuing to offer non-urgent services, but customers may face delays given the increased level of NHS support at those sites. In addition to those 51 hospitals, a further 12 independent hospitals that rely on backup intensive care services in the NHS have had that backup service restricted or suspended. And that's limiting the range of surgical services these hospitals can provide. All of these hospitals are outside of London. In London, hospitals are taking NHS patients to free up capacity for the NHS, but they continue to have good capacity themselves for private patients and are offering a full range of private services. So to put this in context, we have roughly 600 hospitals offering inpatient and day case surgery in our main network. Thinking about it another way, this means that hospitals accounting for roughly 86% of cases are still offering a full range of private services, although customers may face some additional delays at a small number of those. And hospitals accounting for 9% of cases are open for outpatient diagnostics, outpatient consultations, and either urgent surgical cases or local anaesthetic procedures only. Pre-auths are running moderately below prior year levels at this point, but have been on an improving trend since the 23rd of January, when pre-auths for new care journeys started to trend upwards. Now this hasn't yet fed into pre-auths for ongoing treatment, where that trend is still flat. Interestingly, pre-auths in all regions of the country have been impacted to a very similar level, despite services in London being much less affected. And this suggests that much of the drop-off that we've seen is driven by customer behaviour rather than limitations in access to care. So in summary, whilst the NHS is still under lots of pressure, this is easing. We are still seeing a moderate level of disruption to private services, but hospitals are now being released from their surge notices. And whilst pre-auths continue to run below prior year levels, they are now on an upward trend. So I just wanted to give a quick update on our dental services. So all of our private Bupa dental clinics are open and offering a full range of treatments. We want to reassure customers that we can support them in accessing dental care, so you shouldn't delay in seeking help if you need it. Dental, cash plan and PMI customers can use the Bupa Dental Care support line if they're struggling to access an appointment with their own dentist. And we can then help customers find an appointment at one of our Bupa Dental Care centres, or if patients prefer, we can offer virtual checkups or emergency consultations by phone or video from home. That's it from me. Luke, over to you.
Thanks. Good morning, everyone. So I'm going to share a really rapid update on some of the clinical decisions and developments that we're seeing, specifically discussing around the variants of the virus that are emerging and the effectiveness of the vaccines that we're seeing deployed in the UK at the moment. So I think the first thing just to highlight to everyone, give a bit of reassurance, is that viruses naturally mutate. We're seeing lots in the media of concern about mutations, but viruses naturally mutate and change over time, and that includes the coronavirus. Now, a lot of the time, these mutations don't change the virus's behaviour, but depending on where those mutations are in the virus, it may affect its ability to survive, reproduce, and infect, and may cause more severe disease. So I'm just going to walk you through some of the information that we know. Currently, there's no agreed international naming system for these variants. So you'll hear various things used, like the UK Kent variant, the South African variant, the P1. You'll hear the actual mutation used as a reference point for the virus. So it does become quite confusing, but I think fundamentally we will see more and more different mutations emerging as we go longer into this pandemic. So the main mutations we know about are firstly where it allows the virus to attach more strongly to human cells, which make it easier for the virus to get into cells and lead to increased transmission. And I suppose from that point of view, what we're talking about is mutations in an area called the spike receptor binding domain. And you'll hear that mentioned quite a lot, the RBD. And when you get mutations there, the worry is that may, in fact, help the virus avoid the immune system response or avoid the effect of the vaccine. So this slide, which we put up there, lots of detail on it, but is really just to give you an overview of the kind of variants we're seeing emerging, and we're seeing some of these combine. Again, in terms of information around their transmissibility or causing more or worse disease, there's a lot of no information boxes on there, and only time will help us understand the impact of these mutations on the effect on human beings' disease. So, example of this, during our last event, 19th of January, there was no evidence at that time that the UK Kent variant was increasing severity of the disease, and literally 48 hours later, on the 21st of Jan, we had data presented to the SAGE group, which indicated a possible association suggesting that if 1,000 people were to get the original COVID-19 virus, 10 people would die, but this would increase to 13 if infected with the Kent variant. So it just goes to show how quickly things are changing in this space. But the bottom line is we expect mutations to happen. I think we should be reassured around the vaccines, which I'll come on to, that we've got a base level now that can be tweaked to help fight against these variants. So on the next slide, this will detail the kind of effect of the current UK vaccines against the different variants. And again, you can see a lot of amber on there with question marks because we don't yet know the outcome of the studies. And again, only time will tell. We know that the E484K mutation may mean the virus can more efficiently reinfect people who've been previously infected. And we've had lots of information released recently, and some studies showing that some vaccines may be less effective against the variants containing that E484K mutation. But it's important to state it doesn't mean they won't have any effect. And a common misconception we see is that we're aiming for 100% efficacy in the vaccine, and that's not a realistic goal. If you look at the flu vaccines that we've obviously been distributing to people for many, many years in the UK, the typical vaccine effectiveness has been estimated around 30 to 60%. So even if these vaccines have a reduced efficacy, they are still incredibly useful. I think, again, the bottom line here is around, we will see variants emerging. We do have a baseline of vaccines now. In fact, there's 292 in development around the world. And because we've got that baseline of the Pfizer vaccine, the Oxford AstraZeneca vaccine, it's almost certain that we will be able to tweak those vaccines to meet the needs of these emerging variants. So as ever, probably what I've said today will change in the next 48 hours, and studies are continuing, and we expect new information daily. So we'll continue to keep you updated. As always, I'll be around for questions at the end of the session, but I'll hand back to Mark now for the main events.
Thanks, Luke and James. As ever, really insightful update. Great to see you having your finger on the pulse and being able to share that with people. I know yesterday I was certainly quite surprised when Boris came out and made the announcement that the UK will go back to normal on the 21st of June. So I'm sure that's maybe got people's brains moving a bit, and great that you'll be with us for questions at the end, and who knows where that will take us. I know already just on the group there, we're already seeing some questions coming through. So we'll see you towards the end of the session this morning for more insightful stuff there. So moving on to the main topic this morning, how the pandemic is having a toll on mental health, and specifically the rise in addiction. So I'd like to welcome all the panel speakers that I introduced earlier onto the screen. I'm sure you'll see them in a second. So good morning, everyone. Great to have you all here, and thank you so much for joining us today. As I said earlier, we've got a great lineup of expertise today. Caroline Harper, you bring your frontline experience of being a specialist mental health nurse, alongside our second Caroline Wood, who brings expertise in behavioural science. And we're also delighted, Dom, that you've joined us to share your personal and professional experience of addiction. So we're all set for what I'm sure will be an interesting discussion. I'm going to apologise up front. It's not impersonal that I have to keep saying Caroline and Caroline's surnames, but I don't want them to answer the wrong questions in the wrong order. So if I keep using your surname, it's not what I normally do, but there we go. I'm sure we'll get used to it. So without further ado, Caroline Wood, I'm really interested to know why you think we're seeing an increase in addictive behaviours as a result of the pandemic.
Thanks, Mark. Good morning, everyone. It's quite unique to have two Carolines on one call. You don't need me to say that it's clear to see that the COVID pandemic has put a huge strain on everyone's mental well-being. And it's not hard to see why. We're living with day-to-day fear, uncertainty as to what's likely to happen tomorrow, let alone in 6 months' time. Although Boris might have reassured us in some dates in the announcement yesterday. And we're constantly switched on and tuned into the latest news, figures, guidance. Exhausting. And for many of us, multiple lockdowns would have meant not being able to see friends and family as often as we may like. And it's probably fair to say that we can no longer tell whether we are living at work or working from home. We know that factors such as reduced social contact, feelings of isolation and fear associated with contracting or spreading dangerous viruses all have very strong links to poor well-being. Stress, anxiety, depression all tends to rise in parallel, and we can see that this reflected is in the data. Several studies agree that in early 2020, when the first lockdown began, the UK public reported the lowest levels of life satisfaction on record, even since this type of data started being collected way back in 2011. And these levels have stayed low ever since. And to bring those levels of stress, anxiety, and other negative emotions under control, we typically have different coping strategies that we like to turn to in order to help boost us up and restore those very good positive emotions in our well-being. And there's different types of coping strategies. There's behavioural, so enjoying a drink after work or going for a run to clear your head. Cognitive, such as practicing mindful techniques, conscious breathing, and so on. And social strategies, so such as calling a friend for a chat. But in situations where we're faced with unanticipated stress and anxiety, such as now, we can't always use our usual coping strategies or things we become when things become too much for us to handle. And we feel like we want to escape. For some, the perfect definition of the pandemic. And we might develop what we call maladaptive coping strategies. And these tend to be things that we do or changes in the way that we think that ultimately put our physical and our emotional well-being at risk. Drinking to excess, risk-taking, taking drugs, overthinking or ruminating, etc., etc. And they might boost us up for a while, but the stress and anxiety soon return because our strategy never really dealt with that underlying problem. It just managed to mask it. And addiction can happen when we become over-reliant on these strategies to bring our well-being back into check.
Thanks, Caroline. I'm going to go to Dom now, maybe with your expertise and experience, Dom. Can you talk to us a little bit about what trends you're seeing at large and in the Bond Clinic in terms of how COVID is impacting people living and dealing with addiction?
Yeah, of course. I think to start with, it's worth putting everything into context, as the pandemic hasn't created an addiction epidemic, as it were. It was already there. It's just inflated it. I'd like to quote you a couple of things that came out really just before the pandemic. So Michael Mosley, who's a well-known doctor at the BBC, did a Horizon episode back in January 2020 and compared the prescription painkiller problem in the UK to the size of public health issues such as cancer and heart disease. So that sort of puts it into context to start with. If I give you a few figures which are little known because there's been very little data, particularly on prescription drug addiction, which is by far the largest segment of addiction within functioning professionals. There are 3.5 million people currently, pre-pandemic, at risk of addiction because they've been on addictive repeat prescriptions for more than 12 months. There are over 500,000 people who've been on prescriptions since pre-2015, and these are classed as really being in trouble in either chronic, or actually addiction is more of an acute problem as you deal, quite frankly, with life-threatening situations almost on a daily basis. In terms of alcohol, it's probably far more publicized. It's far more in the public domain. It's more difficult to hide, as one of the reasons. But alcohol misuse to dangerous levels was running at around 4 million people before the pandemic. That's now, anecdotally, I might stress, gone up to 8 million during the pandemic. So this is BBC YouGov polls. In terms of self-medication, there are YouGov polls out there that are reporting that self-medication is up 40%. And that is medicating on top of your prescription or illicit drugs, etc., etc. Also worth noting what's happening in the US, because we've done a lot of analysis in preparation for the relaunch of our clinic. The UK is basically 5 years behind the US in terms of its trends. Last year, 80,000, during the pandemic, 2020, 80,000 people in the US died of an OD from a drug. Of which the vast majority are opiate prescriptions, and that's up from 72k. So if you put that into context, that's more service personnel killed since beginning the Vietnam War in 1 year, and that's happening year on year. And the UK death rate is up 16% at the end of 2019, and it must be noted that we do follow similar trends in terms of addiction. As far as the clinic is concerned, we are actually relaunching it. We have a new clinic opening in a couple of weeks' time, but we've been running an outpatient service during the pandemic. And in terms of inquiries, they were up about 300 to 400% in the autumn during the second lockdown. As it started, it's up north as it started to emerge in the north. And those calls really came from right across the socioeconomic spectrum, from the man on the streets with a heroin problem to people of fairly, let's say, structured personal circumstances who are drinking too much. Alcohol was up sharply. There's no doubt about it. There was much more crisis in alcohol, and I'll explain the reasons why later. And prescription and opiate and other illicit drugs were up, although not as sharply. And there are dynamics behind that, because drug addiction tends to be more of a slow burner. So the pool of people that has grown during the pandemic will start to come through when they come into crisis in the next 6 months, year, 2 years. So this is not going to be a sharp uptick of referrals into treatment or referrals into talking therapies. It's going to last quite a long time, with probably a spike in alcohol initially, and then the drug issue coming through over the next couple of years.
Wow, that certainly is very grounding hearing some of those stats, Dom.
I don't mean to be alarmist, but
no. Well, you know, that's what we're here for, is to get under the skin of this, and you know, some of those stats are really eye-opening. Maybe just bringing it perhaps to some actual experience of what we're seeing. Caroline Harper. So, you know, we've heard Dom talk about the fact that addiction is on the rise.
Mm-hmm.
You share with us some examples of the mental and physical health impacts that you're seeing on the front line.
Yeah, so we're seeing a real increase in calls into the business from our Bupa members, and that's a real combination of people who were previously struggling with anxiety, low mood, trauma, but also the addictive behaviours where they have previously been able to develop some abstinence from those addictions, and be that medical and substance issues, or actually the non-substance things like work and exercise, and obviously food intake and addiction has increased as well. So we've seen a real increase. We actually had a 20% increase in calls into our team, the mental health nursing team that offers support, in November, and that coincided with the announcement of the new lockdown at that time. And it was thought that, as Dom mentioned, that was thought to be significantly around alcohol. So it's around the person who's struggling, but it's also around the family members and how they are able to continue living their life and looking after their well-being. So for an example, we have a lady that we've supported whose partner struggles with alcohol use, and she didn't feel safe at home, working from home while they were increasing their alcohol use as they became quite violent towards their partner. So it was about making sure that member of staff had the right support in the workplace and was able to continue going into COVID safe workplace throughout that time. And also around the impact on children. So we've seen a big increase in calls into the business from parents whose children are struggling. They're trying to support their children with what's going on and look after their own well-being. But by the end of the day, the time that they've had to themselves to relax is really quite limited. And it's then when they turn to some of those other behaviours to try and cope and relax at the end of the day, as both Caroline and Dom have mentioned.
Thanks. Yeah, you bring out a really important point there, I think, about the effect on the whole network and the whole family, rather than just maybe the person that's struggling. Caroline Wood, do you think there are certain groups maybe that are more likely to turn to addictive coping behaviours?
Well, what we do know is that certain groups of the population may more readily turn to addictive behaviours, particularly during times of heightened stress and anxiety, such as those we're facing at the moment. Being socially isolated and experiencing extreme levels of stress and anxiety can increase that susceptibility to misuse, addiction, but also relapse. And as Caroline just mentioned then, the pandemic might also trigger those existing or encourage former addictions to come to the surface again. As Mark mentioned in today's intro slides, we know that from Bupa Global's new research, 8 in 10 execs say that they experience symptoms of poor mental health, such as lack of motivation, fatigue, and disturbed sleep. And for 2 in 5, that means that they're self-medicating. And this potentially puts them at higher risk for more serious issues further down the line. And it's not necessarily the usual suspects, which is really interesting when it comes to addictive behaviours that we're seeing. So we've got 34% reporting that they're turning to shopping and spending, and 16% to using gambling to cope. And interesting, some of the more unusual trends around the need to be up to date with the latest stats, figures, and regulations about the pandemic we know are also surfacing as drivers for that anxiety and fueling compulsive behaviours such as doom scrolling. And whilst worrying to hear these stats, the reality is that the mental health toll of the pandemic is likely to be hitting the rest of the workforce, not just execs, regardless of level and in a similar way. For example, we've started to see how our relationship with alcohol as a nation has changed through multiple lockdowns over the past year. Many countries, including the UK, reported a rise in the amount of sales of alcohol. In the UK, sales increased by 22% in March of 2020 alone. And according to some recent insights published by the charity DrinkAware, the most common reasons for people drinking more during lockdown were having that less structure to their days or weeks, having more time available without concrete plans, or just to relieve boredom. And of course, relaxing with the occasional drink is absolutely fine, but the problem really comes when this becomes more often and more excessive.
Thank you, Caroline. Dom, so we're hearing obviously that people are increasingly turning to more addictive coping mechanisms during the pandemic. We've heard about business leaders, maybe even broader workforce, the broader workforce feeling the stress and turning to something, some kind of crutch. When as a leader, when you see a workforce with people under that kind of pressure, can you talk to us a bit about how a leader might notice it in the workplace and where you see it crop up?
Yeah, absolutely. I mean, I think it's important to note that the functioning professional, as we term it, which is categorized as someone who is working, has a structured family, but is living with an addiction, I think I mentioned it before, makes up the largest segment of the addicted population. So, and to a large extent, it is the pool of people that are ignored. A lot of treatment from the NHS, for example, is targeted towards people who've ended up on the street, and other areas of addiction which are perhaps more visible. But those living and working and suffering with an addiction make up by far the largest chunk. So we have to be aware of them. Now, I'm going to talk from slightly personal experience here. I ended up being hooked on 700 milligrams of OxyContin a day, but for 4 years I lived and worked with a painkiller addiction due to some very serious orthopedic issues, and continued to hold down my job. However, my performance was severely affected personally, although the company did all right. And I did things that were not, unless you're in the know, you wouldn't necessarily pick up as addictive behavior. And I just want to go through those very quickly. So the obvious one is a drop in performance, suddenly out of character, or a gradual drop in performance when that person has been performing very well, no matter what level of the company or the businesses that person's at. That would be the very first thing. But the real sort of I'd say bellwethers are things like very irrational excuses for missing meetings, missing a deadline. When it doesn't make sense, it's usually a lie, and that is a pretty good indicator. Things like at senior level, perhaps unneeded business trips, unnecessary business trips, or stretching the reasons for having to go away. That it allows someone with an addict to be in a different place. Addicts with prescription painkillers, for example, will go doctor shopping in the area that they're in to buy more drugs. People with drinking issues will be able to go to the pub more freely and perhaps fuel their addiction. So more business trips is definitely something to look at. Odd deliveries and parcels. You wouldn't know it, but people receive deliveries of their substances at work by DPD. Before 2014, before certain drugs were controlled, like tramadol, you could get them anywhere from any online prescription. Now it's a little more difficult, but the dark web gives you access to just about everything. So if you are an over self-medicator and you run out on your prescription, it is not difficult to get more. So parcels that come in regularly, that sort of thing. Popping out very suddenly, very regularly, that could either be to the pub or it could be to go and see a doctor, not necessarily your GP, but a private doctor who's not connected or have the same EPRs as your residential, as your normal doctor, to get additional scripts, as I say, going to the pub. things like panics, dramas, really big crisis at work, those are also indicators. And then there are things like looking out for someone who's unnecessarily euphoric, for example, and then the next day very low, very down. And once again, judge it against people's normal character. And then you'll be able to see the symptoms pretty quickly. And then there's the physical side of it, which are things like tiredness, sweating, weight change, constant stomach problems, and then more incidents, accidents, admissions to hospital with pretty good excuses behind them. Things like seizures as well. People with severe alcohol problems or prescription drug problems, if they run out of script suddenly, can't get hold of more, they are in danger of going into withdrawal and seizing. It's happened to me on several occasions in very embarrassing places, and I know a lot of people who've had the same thing. So those are the real sort of key, I would say, behavioural aspects. Lockdown has kind of changed the dynamics of all of that, because it is now very difficult to drink heavily when you're at home with your family. You're going to be exposed. It's harder to explain deliveries at home time and time again. It's harder to pop out to go and see a doctor. But it is easy if you live in a city, for example, to go out on the street and get your prescriptions from the street. So all of these things lead towards an individual walking into crisis. Also, 70% of our patients at Bonds have a dual diagnosis, a comorbidity with a mental health disorder, which means that people carrying mental health disorders on top of addiction, and this has been touched on by both Carolines, will then increase the severity of that mental health condition and lead to increased addictive behavior to dangerous levels. But it is much, much easier to hide an addiction from work. Obviously, we're doing everything remotely. Even if an intervention is made and a welfare officer, for example, would make that initial intervention with the patient at work, I think you do have to be very careful not to push that patient further into crisis. What I'm saying here is that remote treatment, any form of remote intervention has to be done by welfare officers or counsellors with experience who have been through this before, because it can go pear-shaped very quickly if you get someone who's just had a day's training in mental health first aid and then takes the wrong move. And I've heard of plenty of stories of this happening. So experience and investment in welfare teams is crucial.
Brilliant. Thank you, Dom, and thanks for sharing some of your own personal experience there. It's interesting. I'm going to come to Caroline Harper in a second, but when I was listening to you there, I was sensing this thing that a lot of this looking out for the warning signs falls on the leader, falls on someone's boss to see, and actually puts pressure on them because they've already got loads of things that they're trying to juggle. And you mentioned mental health first aid. That's the sort of thing that companies can do, and if you're not careful, there you go, we've ticked the box now, we're good to go. So Caroline, what do you think employers can do differently here to try and make sure leaders are supported and the environment's right to support with this kind of hidden pandemic?
Yeah, so it's definitely about trying to hone in on those things that we're missing out. So the things like the visual and sensory cues that a manager or colleagues would usually be able to notice in somebody on their team, we're not having those at the moment. So things like appearing really tired on Zoom calls, or perhaps bloodshot eyes from the night before, or lack of sleep. It's about increasing contact with those members of staff and your colleagues. As you say, it's not just the manager's responsibility. If my team member, my colleague is struggling, it's about setting up a time, even if it's just ad hoc, giving them a quick Zoom call, checking in with them, seeing how they are, giving them opportunity to share how they're feeling. And also it's about compassionate leadership and compassion towards each other. It's about sharing if I'm struggling as well and this is what's going on for me. That opens the door to allow somebody else to share how they're struggling. We may be coping with it in different ways, but it's still a struggle all the same. And it's also a really vital point that I agree with, and I sort of repeat quite a lot in the workplaces. There is definitely a role for mental health first aiders, but there is also definitely a place for the experienced mental health practitioner to be able to support people who may have more complex mental health problems or substance misuse in the workplace. And obviously that workplace is now remote, so it is harder to support others, and it's about working a bit more creatively. And I think we will see a development in occupational health services with that as well. So I know some companies have moved towards what they term hybrid services, so something on site and then also at another site. And I think that's going to probably evolve even more. There's probably going to be some remote input to add to that as well.
Brilliant, thank you. And Dom, just quickly, we're going to get to a poll in a second, but just quickly, why do you think people don't speak up about the problem?
Yeah, I mean, it's a fact that most people will not come forward. They'll get caught. Addiction ends up in a crisis, and that's when it all comes out. But on a positive note, the pandemic has reduced some part of the stigma because everyone's talking about it, particularly with alcohol. It's much more in the open now, and there needs to be a national effort to tackle it. But the main reasons are, I think, pretty obvious for anybody in the know. But fear of life without substances, you are a different person when you're under the influence, and that is absolutely key. We are an abstinence-based treatment. We believe that that recovery has to start with abstinence relatively quickly before you can move into your talking therapies. But that poses fears for patients. What is life like without that protection? Withdrawals, that this is key and it's not often talked about. Withdrawal symptoms from any form of substance is fairly unpleasant. Withdrawal symptoms from a heavy drinking problem or prescription medication such as opiates or benzos is hell. I have been through 23 operations in 10 years. I've been on a ventilator for 3 months and lost the use of my lower limbs, but I can tell you that withdrawals are by far the worst things I have experienced. And so the fear of the pain, the suffering of going through treatment, a long weaning process is absolutely paramount to people not coming forward. So it's important to find treatment services, and I'll say like the Bonds Clinic, that get you through that acute withdrawal phase without any pain and relatively quickly. Thirdly, obviously stigmatization amongst colleagues and losing your job. I mean, the fear is that if you come forward and the truth comes out, and it always does in the end, the truth is so shocking that employers cannot feasibly continue to employ you. So that's obviously a big barrier. I've mentioned most treatment that is out there is viewed as long-term rehab, months and months and months locked away before you're then released into the outside world. For people at work, particularly senior executives, that's a problem. You cannot justify taking months away on a sabbatical and then walk back into work. Plus, it'll expose the problem to colleagues, and so therefore that puts up a barrier. So time away, compressed time away, where you could even justify a holiday away and go into treatment and come back and then start your recovery whilst you're reintegrating back into work, would remove that really big barrier. And I've mentioned fear of exposing the double life. You do lead a double life when you're an addict. You are a different person, and you must remember that when you're recovering, that it actually, no matter how you got into it, at the end of the day, when you're clean and you're recovered, that's the person who you are. But fears of really uncovering what's been going on is another barrier. And last of all, again, this is not talked about much, but addiction is always associated with mental health. It is a very, very physical medical condition. The withdrawals speak for themselves on that. And a lot of people, 80% of all drug addicts 80% of all drug addicts have been introduced to drug for the first time via a medical intervention. So got a strip for an addictive drug, then fell into trouble, and then starts self-medicating. And so many people believe that they have a medical problem, not a mental health problem. And so therefore, the priority is to treat the physical first and then deal with the mental health problem discreetly and gradually during the course of the recovery. So you should, I would advise that that this issue is raised, that treatments which provide very safe medical detoxes to start with, followed by talking therapies, are very, very important. And it reduces the stigma. If you go to a manager and say, look, I think you're in trouble medically, they're more likely to come forward rather than raise the stigma of mental health.
Brilliant. Thank you, Dom. Going to just set the poll just on this concept of whether people feel comfortable about opening up. So the poll hopefully will appear on the screen in a second. So the question on the poll is, if you were struggling with an addiction, would you feel comfortable with discussing this with your manager? Yes or no? And while you're all having a think about that, I'm just going to come to Caroline Wood. Caroline, how do you think things are going to change when we do get back into some kind of sense of normality? So after the 21st of June, when everything's back to normal, is this all going to go away?
A big question mark. Well, it's likely that when the pandemic starts to lift, it could be that over time, some behaviours revert back to how they sort of looked pre-pandemic. And that's going to be simply because we're not in the environment that cues those particular behaviours or ways of thinking to occur. For example, if we start to commute back to the office, we're spending less time at home, there could be less temptation around to, for instance, drink excessive amounts. Other behaviours which may be less dependent on a certain context or environment, things that we might be able to do anywhere at any time, such as excessive smoking, over or under eating, gambling, when we've learned over the pandemic that doing these things helps us manage how we're feeling and makes us feel better. These are going to require us to make more of that conscious effort to break that cycle. And addictions on a basic level exist because we form that psychological link between something we do and how it makes us feel. Not to oversimplify it, because it's not a simple thing to talk about at all. And over time, this association gets attached to certain cues or prompts that exist within us or in our environment and end up strengthening that addiction. It's a very vicious cycle. So for example, if we're stressed and our coping mechanism is to reach for a glass of wine, our bodies habituate to receiving that alcohol as a stimulant and can learn to associate the cue of feeling stressed with the action of pouring a glass. So the next time we're feeling stressed, remember that alcohol made us relax, and we may help ourselves to a glass without a second thought. So it becomes that real vicious cycle unless we consciously break the links. So identifying triggers for the behaviour and then having a plan of action of how to recognise and avoid certain situations where you're likely to feel like you're going to slip back into those old habits is absolutely key.
Great, thank you. So we've got the results in of the poll. They're kind of perhaps where we all expected them to be. About just over 200 people responded, and 76% of people who filled the poll in said that they would feel uncomfortable and wouldn't want to share any details about their problems with their manager. So I think all the more responsibility back on the organisation to find ways and means of making that easier. Caroline Harper, we're just going to some questions that are coming in on the feed now, and to be honest, we could be here for about another 3 hours. I think the number of questions I've got. We hear a lot about children's mental health through the crisis. Have you got any thoughts about that specifically in relation to maybe coping with a family member or even addictive behaviour in children? Anything you share?
Yeah, definitely. So I recently worked on the Bupa Teen Mental Health campaign, and that research showed a huge increase in children struggling with their mental health and how they cope with that. And that also involves some unhealthy coping strategies such as hair pulling and self-harm, unfortunately. We know some of that is sort of observed behaviour from different influences, but we also know that there can be a genetic link with addictions. So we know that if it's very much the norm for parents to have a drink in the house to relax. That can be something that, you know, children go up with and turn to themselves in the future. And most typically that may be at a normal level, but it's also about where there's more significant issue than that, and where it does become an unhealthy coping strategy. It's also not about alcohol, it's about other behaviours. So what I've seen through the last 12 months is parents struggling with the children being at home, but also then turning to different coping strategies, such as exercise has been a big one. Whilst it started off as a really healthy coping strategy, that in itself can become an addiction. And it's just being aware that certain things, you know, can tip into that unhealthy coping strategies at times. And obviously we're more at risk of that if we're predisposed to a mental health problem, if there's a family history of addiction, and also during the pandemic when we've had the positive coping strategies removed from us.
Thank you. And Caroline Wood, we've talked a lot, I think, in general about the workplace, but specifically remote working. I know Dom referred to it about the packages arriving at home and the drinking at home. But is there anything that you think specifically you're working harder on to spot the signs with remote working?
Yeah, it's a real tricky one, because resilience in the team, whilst you're working from home and everyone's remote, will really differ across different organisations. Some teams will absolutely thrive, whilst others may really struggle to adapt and continue to struggle as time goes on. And both of these are fluid over time, so they will change. So there's unlikely to be a one-size-fits-all approach, but what we can do is draw on behaviourally informed principles based on how people typically respond in high-stress situations to really guide how we best support mental well-being whilst everyone's working remote still. The first top tip is a biggie, but to create a sense of community and shared identity. We're heavily influenced by who tells us information, so choosing the right messenger to convey that information about mental health and well-being to your teams can go a long way to increasing that trust and engagement, encouraging people to open up a bit more. For example, a regular informal vlog from the senior leadership team, for example, may help to open up appreciation that everyone is going through the same thing and was likely to have a similar experience no matter what their seniority level is. And second top tip, using simple prompts to promote more one-to-one connections, and both Dom and Caroline have touched on this as well. It's not necessarily about more meetings, but it's about more meaningful meetings. There's a place for team meetings, absolutely, and perhaps more informal virtual socials, but research suggests that finding time for those one-on-one conversations with your team carries a more meaningful impact, more now than it ever did before. It's about knowing the type of questions to ask that go beyond the simple "how are you?" And that's absolutely key in one-to-one. So such as questions like, what's been the best part of your week so far? How are you coping? Sharing different tips between senior leaders and more junior staff. And it's about personalising that one-to-one meeting as well, giving your team the licence to choose whether they have their video on or off. Sounds really simple, but some may find it easier to open up if it's only audio. Likewise, trying a walk and talk meeting, people may find it easier to open up if they're in a situation where it's not just you and the screen. It can feel quite intimidating to some.
Thank you. I'm really conscious of time, and I wanted to bring Luke and James back in because we have got some questions for them. I have to be honest with Luke and James, even though they're here every time, they've got nowhere near as many questions coming through on the feed as you three, and we're gonna run out of time. I'm just going to finish on this topic with one quick question. I'm going to come to you, Caroline Harper. So we heard all this. Are we still okay if we feel like it though to crack open the bottle of wine, even if our kids are watching? How do we know that that's still going to be okay?
Absolutely. You know, as I've said, we all have that toolkit of coping strategies, don't we? We all know there's certain things that works for us to try and relax. And for many people, there is a normal amount to that, and that works. There's a place for that, isn't there? But it's about being aware of when that does tip over into being an issue, and if it's becoming more of an extreme type of crutch rather than just something that you look forward to and enjoy as part of your working week.
Brilliant. Thank you. I'm sure there's some people that are reassured.
Yeah.
So, I'm just going to bring James back. Luke, I've seen you kind of watching really closely as the whole kind of discussion's been going on. I don't know if there's any thoughts you'd got around this whole topic from your own experience.
I think from the perspective of, can you hear me okay? I know there's a problem with sound earlier.
Yeah.
Yeah, good. I think from the perspective of this blurring of people's boundaries, which I think we've talked about, and therefore how they deal with that, and that's where the pressure is coming for people, whether they've had addiction problems before or mental health problems before. It's the disruption to their usual routines and their usual boundaries that I think is the real impact that I've seen in patients during the year.
Thanks, James. Sorry, thanks, Luke. Too many James and too many Carolines on this call. James Sherwood. Just from your perspective, in terms of Bupa's ability to manage all of this, any thoughts you've got around what we're seeing and how we're trying to develop our own capabilities?
It's interesting. Like addiction therapies, I think, as Don mentioned, haven't really changed for quite a long time. A lot of them are quite kind of long-term residential based, and you've
lost your sound, James, I think.
Can you hear me?
Yeah.
So I was just trying to say that the bonds clinic are offering something a little bit different. So they offer a different pathway that promises better outcomes. So we what we try and do at Bupa is we try and keep an eye out for new services that we think can deliver better outcomes for customers, and try and bring them into our portfolio of stuff we offer to our customers. So I guess that's what we're doing, Mark. Great,
thanks, James. And Luke, just one last question before we have to wrap up, which is off topic, back to the old topic of COVID-19. So yesterday, Prime Minister made some announcements, and on the 12th of April, we're still under fairly heavy restrictions, but by the 22nd of June, we could have Wembley Stadium full and all the pubs full as the Euros go on. Something seems a bit strange about that such a short period of time we can make such progress. As a GP, as a healthcare professional who's held our hand through this whole process, thoughts? Are you worried about
that? So I'm pretty combative about this. I'm not worried. I think many of us would have liked to seen the lockdown kind of released quicker. And we've got 17, 18 million people now vaccinated. So I think that debate's going to be had. At some point, we need to see the vaccines working in the real world. But clearly, it's going to be with caution. So when you do get those events back opening, you're going to find that social distancing, masks, testing regimes, surge testing, they're all going to be in place to support this approach when we get released from lockdown.
Great, thank you, Luke. And I think, conscious of time, we're going to have to wrap things up there. I wish I'd just been watching today instead of having to try and juggle all the different screens and questions coming in. It was brilliant, and thank you, especially to Don, for some of your disclosure there about some of the things you've been through yourself. A really, really fascinating panel. What I took from it is this is a very kind of blurred topic, that it isn't just as simple as saying it's about addiction. We talked about mental health, we talked about physical health, we talked about family, but certainly as employers and leaders ourselves, I think what I've taken more than anything is there's a real responsibility on us all to be alert and think about what we can do to just make it that bit easier to maybe start to change some of those poll results. If someone's got nowhere to go and desperately does need some help, it's a real tragedy that they feel that they can't talk to their line manager, or that their employer maybe won't be sympathetic. So I think that's the thing maybe for us collectively as an industry to be thinking about. So thank you so much for joining us again today. Over 600 of you again online joining us. We've had so many questions through today, so we will make sure we get all those answers back. And we look forward to seeing you again in a few weeks' time, when hopefully Luke's confidence about lockdown easing will be even more secure than it is today. And I hope stay safe, and we'll see you soon. Thanks very much for joining.